Chapter 25, Violence and Human Abuse. Significant mortality and morbidity can result from violence. Violence are considered non-accidental deaths, interpersonal or intrapersonal, that result in physical or psychological injury to one or more of the people involved. Nurses are often people who are considered the first responders in recognizing and dealing with violence, and that's a very important concept, that we often care for the victims, the perpetrators, and those who witness physical and psychological violence. And nurses can take on the active role in developing community responses to violence through working on public policy and needed resources within the community. Social and community factors. Work can be related to violence. Work can be both fulfilling and contribute to a sense of well-being, but also it can be frustrating and unfulfilling, contributing to stress that may lead to aggression and violence. And this is something that has been identified, that people stay in jobs that they really are very unhappy in because of financial reasons, and maybe that has led to some of the workplace violence, both horizontal violence where people mistreat, bully, one another, up to, committing homicide, assaults and homicide within the workplace and also in the community. So this frustration and resentment may contribute to violent behavior, and workers may have difficulty separating their feelings generated at work from those at home. And also people who are unemployed, they also have a real sense of frustration and resentment that might lead to violent behavior also. Um, Social and community factors and related to education. In recent years, schools have assumed many of the responsibilities traditionally assigned to the family, such as sex education and discipline. Also, at the same time, our schools have gotten larger, and in large classrooms, teachers may be unable to care for every child's needs, and the children who need extra care, who need to be identified, are not getting the attention and the care that they need. The book identifies spanking as a community factor, and I know there are different opinions on whether spanking is a good thing or not. The book points out that spanking a child may lead to them to believe that this is how they resolve problems, and that they may be more likely to strike out if they have had spankings. And then the book goes into quite into depth, talking about bullying. And bullying can occur. It does not have to be just in school. It can be done, both inside and outside of school. But it's especially important to realize that it can happen through, attacks or intimidation, but also through technology. And it's usually there's a real imbalance in power between the bully and the victim, and there may be several repeated attacks and intimidation of the same child or children over time. So this is something that we look at in community health that we would like to see less of. We want to recognize children who have poor impulsivity or poor self-control, sometimes harsh parenting, and an acceptance towards violence in the home may contribute to this. The child who is also a child who factors that may be associated with being a victim of a bully are children who have trouble making friends, have poor self-esteem, and being quiet and lacking assertiveness, who would be willing to, or more likely to put up with the bullying. And school can be a powerful contributor to nonviolence as well. I know that there are bullying initiatives, to anti-bullying initiatives in all of the public schools, and schools can be a powerful contributor to nonviolence or a source of violence through stressors and through frustration. But some of the ways that we can address school violence is to identify risk factors, look at the protective factors, develop and test prevention strategies, and ensure widespread adoption. Social and community factors related to media. The media can influence the occurrence of both violence and caring or compassionate factors because it's so widely present in our society. Television programs and print articles can inform and increase public awareness about family violence, so it can be used as a good thing. Abused women and rape victims benefit from media attention because it tends to lessen the stigma of victimization and publicizes available services. Or the media can indirectly lead people to choose violence, portraying the world as a violent place with a poor role model for anger management. Other social and community factors in the population, a community structure can influence the potential for violence. The book suggests that overcrowded areas have a greater potential for tension and violence. People who live in poor conditions, lack of jobs and low-paying jobs can lead to feelings of inadequacy, despair, and social alienation. And then also the um, particularly young people who deal with feelings of powerlessness by forming gangs. And some of the overriding risk factors seem to be poverty and lack of education when people try to deal with their feelings about engaging in crime against people and property. But joining a gang can be a highly destructive way of showing that. And there's okay, that's all on that. Communities differ in resources and the facilities also that they provide to residents. Some are more desirable places to live work, and raise families, and have facilities that can reduce the potential for crime and violence. Recreational facilities, these are some things that are found that really contribute to positives within the community, are recreational facilities such as playgrounds and parks, swimming pools, movie theaters, tennis courts, and these provide socially acceptable outlets for a variety of feelings, including aggression. So it's very important that people have that sense of this is where they want to live, and allows the community to to come together in a way that is nonviolent. Violence against individuals or oneself. Homicide is the killing of one human being by another, and an assault is a violent physical or verbal attack. And there are both emotional and financial costs associated with, of course, with homicide, but even with assault. It seems that our young people are the most affected by it in the United States. That young women between the ages of 18 and 25 have particularly have been found to be at high risk, and this includes particularly more so certain populations. African Americans, Native Americans, and Latinos tend to have a higher degree of assaults and violence within their population, and young women being at the top of that. Nurses may be in a position to be able to help someone identify someone who has been assaulted. And you may actually be caring for somebody who's been assaulted, like a home health nurse. You may be caring for somebody who was a victim of an assault in the community, such as doing home health with somebody with a gunshot wound or a head injury or a paraplegia from some type of assault. Sexual violence is forcing a person to take part in a sexual act when the person does not consent. And again, young women are more likely to be a victim of this. Among young women, 1 in 4 to 1 in 5 in our books is 1 in 5 young women have been sexually assaulted. This often goes unreported. About 75% of the time it involves alcohol. So that is where we direct our education, is towards avoiding alcohol in dating situations, and in being around people that the young woman might be unfamiliar with. There's also bystander education that looks at that the bystanders can certainly have some responsibility, and they also have to intervene if they see a woman is being assaulted, a man or a woman is being assaulted, because it certainly is not just man on woman. It can be man on man, or same sex assault, sexual assaults. So that bystander education is very important, and also certain programs that address the potential perpetrators. So one very effective program has been Coaching Boys to Men by coaches who work with young men in athletic events, to talk to them about what is right, as far as touching another person, and so forth. Okay, and let's see. Suicide is an act of or an instant of taking one's own life voluntarily and intentionally. Just some other, assaults and homicide rates have really escalated since 1970. It's usually by a person that they know. Women are the most likely to be a victim. Some top risk factors for intimate partner violence, which is domestic violence also, is a history of domestic violence, previous history of domestic violence. Usually it's somebody that the person knows. And there are other, I've got some other information on family violence on the next slide. Persons who are more likely to be a victim of homicide is if domestic violence has been already identified. The perpetrator has an access to guns, if there's some type of estrangement, if there have been previous threats to kill, threats with a weapon, if there has been a previous episode of non-fatal strangulation, or if there's a stepchild in the home. And this is 75% of persons who were a victim of domestic violence homicide have been seen by a health provider in the past year. So that's the reason it's so important to ask people. That is a part of our assessment. That is anyone harming you? That's almost every healthcare organization now. We ask that when we see patients, particularly outpatient. And it is appropriate to warn people that the result of continued domestic violence and intimate partner violence potentially could result in injury, severe injury, and death. Family violence and abuse, the development of results from the development of abusive patterns, and this is a pattern, and that's what has to be broken, is the pattern that is continuing. So it can be physical abuse, sexual abuse, neglect, could be child abuse, intimate partner abuse, and or abuse of older adults. So some questions that we might ask in the community to someone who might be a victim of domestic violence or intimate partner violence is: someone hurting you? You seem frightened of your partner. Has he hurt you? Did someone you know do this to you? So this is something, if you see bruises or see some signs. As far as child abuse, any child with an unexplained injury, such as burns, bruises, old scars, bruising, and different varying states of healing, soft tissue swelling, human bites, fractures. These can be recent or older ones that have healed, subdural hematoma, trauma to the genital area, whiplash from being shaken, dehydration or malnutrition without an obvious cause, taking inappropriate foods or drugs, if the child looks poorly cared for, if they are always considered as a bad child, or if they are inappropriately dressed for the season or the weather. If they seem to be taking on the parenting role, that can sometimes be the sign of abuse, and a history of abuse in the home and maternal depression. Those are all indicators, or potential indicators for child abuse. As far as abuse of older adults, some things that you can look at is a financial mismanagement, the older adult becoming more withdrawn, acting more passive, if they have depression, if they have an unexplained or repeated physical injury, untreated health problems such as decubitus, poor nutrition, an older adult with a sexually transmitted infection, neglect or unmet needs, and rejection of assistance by the professional caregiver. Violence against individual or oneself. Let's see, we just did that one. I think I went backwards. Well, violence against, okay. All right. So, nursing interventions are the ideal nurses are in an ideal situation to identify potential victims of family abuse because the nurses see the clients in a variety of settings. We see them in schools, businesses, homes, and clinics. So we see them in a lot of other places beside, in the hospital setting, and where somebody could maybe, work, fake it or get through it while they're in the hospital. But once they're at home, I mean, we see people sometimes on a more frequent basis. Domestic intimate partner violence is multifactorial and problem and requires interventions for each level of prevention for individuals, families, and the community. And I gave you a link here to a TED Talk, and I also will post that in D2L. But it looks at a story of a woman who was a victim of domestic violence. And that is the end of this lecture.